Good evening, everyone. Today I shall briefly conduct a small integrated session on post-antibiotic effect, which has relevance to the postgraduates of pharmacology as well as for the microbiology. It is also clinically relevant to know this effect. Now, the objective of this session are to understand key pharmacokinetic, pharmacodynamic parameters of antibacterial agents. One of them, which today I will discuss, is the post-antibiotic effect. To appreciate the post-antibiotic effect as an important contributory factor in vivo and in vitro determining dosing schedule of an antibacterial agent, and to identify two other contributing factors: post-antibiotic sub-MIC effect and post-antibiotic leukocyte enhancement effect, and these also contribute to overall post-antibiotic. Now, in order to understand the antimicrobial pharmacodynamics, we need to know concentration effect relationship, that is concentration dependent killing or time dependent killing, then antimicrobial susceptibility testing, knowing MIC and MBCs with antimicrobial activity as bactericidal or bacteriostatic against a given organism. There is also synergism and antagonism on addition of two drugs together, and the most important, which we will be discussing now, is post-antibiotic effect, which will include post-antibiotic sub-MIC effect and PALE, that is post-antibiotic leukocyte. Now, if you look at the concentration time curve of a single dose of antibacterial agent, there will be a rise followed by fall, and fall will be gradual. And if we plot it against MIC, known MIC, then the parameters which can be seen are Cmax as the maximum concentration at Tmax, that will be time, then a ratio of Cmax to MIC, and then there is T more than MIC. Now these two parameters, Cmax, MIC and Tmic, are well known for concentration dependent and time dependent killing. Now another parameter is AUC, area under curve, divided by MIC, and for some of the concentration dependent killing organisms this may be more important in determining clinical efficacy, and is easy to calculate as well. The post-antibiotic effect, as is seen in the pictorial, is the effect on the bacterial growth in the concentration of antibiotic below MIC, and this is the period where still some antibacterial activity persists, and this is called as post-antibiotic. So it is post-antibiotic effect, or PAE, refers to the period of time after antimicrobial concentration has fallen below the MIC and during which the growth of target bacteria remain suppressed. This persistent antibacterial effect after stopping antibiotic is due to the fact that exposed bacteria take time to return to log growth and may have low virulence, and so become more susceptible to host immune system and host defense disposal. Postulated mechanisms are many: gradual recovery of enzymes or proteins which are affected by antibiotic, and this recovery after antibacterial exposure takes time. There is also presence of some drug in the periplasmic space, and that may exert some antimicrobial action. When fresh organisms are injected into animals during PAE period, there is a rapid and immediate growth, suggesting that PA is on the exposed bacteria only and not on the fresh bacteria as such. Another mechanism has been suggested by Srimani et al., And authors have shown that transient exposure to antibacterials inhibit bacterial efflux mechanism and increase the rate of ribosomal degradation. And this is an antibiotic effect. And this effect may persist after stopping the antibiotic. Therefore, antibiotic-exposed bacteria require time to recover efficiency of the efflux pump to extrude intracellular antibacterial agents, allowing ribosomal reactivation. The post-antibiotic effect duration varies from bacteria to bacteria and from type of the antibacterial use. It is seen both against gram-negative and gram-positive organisms, and is remarkably seen with bactericidals, but may also be shown by few bacteriostatic. Now, some of the bacteriostatic drugs have prolonged PAE, and this is determined by 24-hour AUC to MIC ratio. Higher the ratio, greater the PAE effect expected. Prolonged PAE allows these drugs to be efficaciously even when concentration exceeds the MIC for less than 50% of the dosing interval. That is the beauty of drugs like clarithromycin, clindamycin, erythromycin, linezolid, streptogramin, tetracycline, tigecycline. In particular, tigecycline PAE in vivo has been reported to be 8.9 hours for Staphylococcus pneumoniae and 4.9 hours for E. coli, showing that it varies with the drug as well as with the. Now, how do we quantify PAE? A standard term is T minus C, where T is the time required for the viable counts of the antibiotic exposed cultures to increase by 1 log 10 above the counts observed immediately after washing, and C is the corresponding time for the controls. So T minus C time is the PAE. PAE is observed both in vivo and in vitro test also. In vivo, usually animal test can be demonstrated. Often in vivo PAE is longer than in vitro PAE due to post-antibiotic leukocyte enhancement phenomena we will be discussing later. Some antibacterials exhibit concentration-dependent post-antibiotic effect, aminoglycosides and fluoroquinolones, and it can be longer for rifampicin. Linezolid exhibits a post-antibiotic effect which is more prolonged at 4 MICs than at 1 MIC against Staphylococcus aureus, showing that it is concentration dependent. Duration of PAE varies, as I told you earlier, is reported usually more than 1.5 hours, but can be 2 to 6 hours for fluoroquinolones, aminoglycosides and daptomycin, or it can be still more. Highest has been demonstrated with use of quinopristine delphopristine combination. Anti-gram positive antibacterials show in vitro PAE more than 1.5 hours. Antibacterials such as aminoglycosides, rifampicin, carbapenems, fluoroquinolone, tetracycline, tigecycline also exhibit in vitro PAE more than 1.5 hours against gram-negative organisms. Of notable is beta-lactams show negligible PAE against gram-negative, and this is the table that shows drugs with low PAE and drugs with high PAE. Aminoglycosides, clindamycin, macrolides, tetracyclines, rifampicin, whether bacteriostatic or bactericidal, have longer and higher PAE, and intermittent dosing, once a daily dose or high dose extended interval therapy is suggested. In contrast, antibacterials with low or no PAE, these agents require continuous exposure above MIC levels for adequate antibacterial action. Therefore, frequent regular dosing or IV continuous therapy in severe cases is needed. Post-antibiotic sub-MIC effect is an interesting phenomena where an in vitro measure of time in which persistent sub-inhibitory levels of the antibiotics could extend the PAE. It includes the time interval of PAE plus the additional time interval during which growth is suppressed by additional sub-MIC concentrations of antibiotics. Therefore, PA-SME is longer than PAE for most of the tested organisms, and its duration varies with the antibacterial agent as well as the nature of the pest. Quantification of PA-SME is done in the same way. The formula is TPA minus C, where TPA is the time for cultures previously exposed to antibiotic and then re-exposed to different sub-MICs to increase growth by 1 log 10 above the counts immediately after dilution, and C is the corresponding time for unre-exposed controls. The sub-MIC concentrations are far below MICs, and in practice concern use are 0.1 to less than 1 microgram per ml, and at least 3 sub-MIC concentrations. Now, another phenomena is post-antibiotic leukocyte enhancement, or PALE. Increased susceptibility of antibiotic exposed bacteria to white cell killing, including macrophages, is called as post-antibiotic leukocyte enhancement. The mechanism is antibiotics induce bacterial sensitization to leukocytes is commonly observed mechanism, but macrophage mediated immunoregulation may also be involved. Immunomodulation by macrolide antibiotics is demonstrated in several studies clinically in respiratory disorders. Therefore, this is again an important contributor to. After all, what is the clinical relevance of studying PAE? Both PALE and PAE sub-MIC contribute to PAE clinically. In order to better understand the efficacy of intermittent dosing of antibacterial agent, PAE and PA-SME time durations were originally suggested by Arnold Tornquist et al. In 92-93, and it is increasingly realized that antibacterials with long PAE can be dosed less frequently, making it advantageous for drugs with greater toxic potential because it reduces cumulative dose exposure. Example is aminoglycoside given once daily to reduce the renal toxicity without compromising the efficacy. So thank you very much for this brief discussion. Relevant references are given, and I hope that postgraduates and their learners would benefit from this discourse. Thank you.